You've probably heard the name, especially over the last few years. Dexamethasone. It's a medication that can literally pull people back from the brink of death. It's one of the most powerful and widely used drugs we have. So what exactly is it, and why is its story so complicated? Let's break it down.
So which is it? Is dexamethasone a life-saving wonder drug, or is it more of a high-stakes gamble? Well, the truth is, it's kind of both. And understanding that paradox is really key to understanding a big part of modern medicine.
It really is one of medicine's most powerful double-edged swords. Its incredible ability to save lives is matched only by its potential for some really serious harm if it's not used with extreme care.
So let's start with the basics. What is this stuff? Well, at its core, dexamethasone is a potent synthetic corticosteroid. You can think of it as a kind of medical supersteroid. To really get what dexamethasone does, we have to start with something your own body makes, called cortisol. It's your natural stress hormone. Your body releases it to deal with threats, and, really importantly, to keep inflammation under control. Dexamethasone is basically a man-made version designed to mimic and massively crank up those anti-inflammatory effects.
But here is where it gets absolutely wild. We're not talking about a small boost in power here, no way. Dexamethasone is somewhere between 25 to 30 times more powerful than the cortisol your body makes on its own. That incredible strength is what makes it so amazing and also what makes it so risky.
So, how does it use all that power? Well, a good way to think about inflammation is like a fire that's raging out of control inside your body. Dexamethasone's job is to be the ultimate firefighter, taming that blaze right at the cellular level. And here's how that firefighting actually works on a microscopic scale. The drug gets inside a cell, travels right to the nucleus, the cell's command center, and it literally starts flipping switches on your genes. It tells them to stop producing the chemicals that fuel the fire. At the same time, it tells your immune system's frontline soldiers, your T cells and B cells, to just stand down. This amazing ability to shut down inflammation at its source makes dexamethasone an absolute powerhouse, and it's used in a huge range of situations, from treating chronic diseases to fighting global pandemics. Its primary gig is fighting severe, out-of-control inflammation. For people with really debilitating autoimmune diseases like rheumatoid arthritis or lupus, or for someone who's in the middle of a life-threatening asthma attack or allergic reaction, dexamethasone can be the drug that brings them back from the brink by calming that internal fire. It's also a critical ally in cancer therapy. It's used to shrink swelling around brain tumors, which can give surgeons a much better shot. It's also incredibly effective at preventing the awful nausea that so often comes with chemotherapy. And in some blood cancers, like multiple myeloma, it can even attack and kill the cancer cells directly. And the list just keeps going. It's used to help the lungs of premature babies develop faster so they can breathe. And of course, the big one we all heard about, during the COVID-19 pandemic, it was proven to reduce mortality in the sickest patients by calming that cytokine storm. You know, that out-of-control immune response that was proving to be so deadly. Okay, so we've seen the incredible power. But like we said, every double-edged sword has another side. And with dexamethasone, there is a very real price to pay for that power, especially when you have to use it long-term. How long you're on this medication is everything. If you just take it for a few days, the side effects are usually manageable. You know, maybe some trouble sleeping, feeling super hungry, maybe some mood changes. But when you're on it for weeks or months, the risks become much, much more serious. One of the most well-known risks is a condition called Cushing syndrome. This is what happens when your body is exposed to high levels of steroids for too long. It leads to a pretty distinct set of symptoms, like a rounded, reddish face, weight gain that's concentrated right around the belly, and skin that gets thin and bruises really easily. But the risks go even deeper than that. Long-term use can weaken your bones, leading to osteoporosis and a higher risk of fractures. Because it's designed to suppress your immune system, it leaves you more vulnerable to infections. It can also raise your blood sugar, sometimes even triggering diabetes. And it increases the risk of stomach ulcers. The key takeaway here is that this is absolutely not a drug to be taken lightly. All of this just means that using dexamethasone is a very delicate art. It requires constant medical supervision and a really deep understanding of how to use it wisely. And look, if there is one single thing you take away from this explainer about safety, let it be this. You must never, ever, ever stop taking long-term dexamethasone suddenly. It is incredibly dangerous. And here's why. When you take dexamethasone for a long time, your body's own cortisol factories, your adrenal glands, they basically go to sleep. They stop working. If you just stop the drug cold turkey, they can't wake up fast enough. This can cause a life-threatening emergency called an adrenal crisis. The only safe way to stop is to taper the dose down slowly, giving your glands the time they need to wake up and start working again.
So ultimately, dexamethasone is always going to be this careful balancing act. In the hands of a skilled doctor, it's an absolutely indispensable tool that saves lives every single day. But its use always requires weighing the profound benefits against some very, very real risks.
And that really leaves us with a final crucial question. With a drug that has this much power, but also this much risk, what does the future look like? Can we one day design a treatment that has all of the firefighting power of dexamethasone, but none of the danger? Well, that is the next frontier in medicine. Thanks for joining us.